more likely. Things that we experience all the time, like, earthquakes, mudslides. So one of the projects that we did are what we call pods, points of dispensing, and we use this to test the throughput and see how many people we could get going through a flu clinic. So since we don't like to get out of our cars in California, we do drive-through seasonal flu vaccination clinics, which are very successful because it makes it easier for people to do it. They can get through in 5 minutes. You learn a lot of things. Like, for instance, when people come to get their flu shot, they bring their dog. Nurse sticks her head in there to give a shot. The dog likes to bite. So things like, well, bring the family, but maybe leave the family pets at home. Those things are learning issues that you learn all the time. When we started to do this, to do flu clinics, we asked BENS, the business executives for national security, to help us with this because, they said, oh, there are all these large businesses and they want to be involved and they want to help the government. Well, when we looked at who the large employers were in Los Angeles County, well, the #1 largest employer is the county, 91,000 employees. Second to that is federal and state government employees, 83,000. Then the cities, 60,000. The public school districts and the schools. And then the next largest employer was Kaiser Permanente Hospital System. So all our large businesses in the county is actually the government. So, you would think in Los Angeles, from all the input that we get, that the movie studios would be, the largest employers. They're not, or maybe some of the, defense contractors, things like that. But they're not. Plus, things are further complicated by, if you're going to worry about, protecting your workforce, a pretty significant part of our population also works out of the county. As you know, in LA, there's a lot of commute times. There are some people who commute up to 2 hours each way to work. So at the health department, we have experience working with other diseases and events, such as, SARS, West Nile. We have had some, potential. They met the definition for avian flu, but then they were ruled out, once the lab testing was done. But, with earthquakes, floods, riots. But all these things do help us with preparedness, and that's basically what we want to do is just help to be prepared. I remember working at the health department not too long ago when, we didn't even have funding, to buy pencils. So all this, increase in funding helps with basic public health infrastructure, and we can't complain about that. So, SARS, monkeypox, terrorism, West Nile, we've had it all. Bad weather in LA is, 1 inch of rain, so they really don't know how to drive in the rain there at all. So we've always been a little bit ahead of the curve because we've always stuck with science and we've tried to use a very practical approach to things. We were working on a pandemic influenza plan back in the early 2000s, and we actually drafted a plan for hospitals in 2004. Partnerships for us is natural because we can't do everything alone. We have hospital outreach unit that works at public health. It reaches out to all the hospitals to be able to do some disease surveillance. Plus, we have partners at the Los Angeles International Airport quarantine station, our first responders, EMS, schools and universities. We've had the 22 rule-out SARS cases. That was actually the impetus for forming the hospital outreach unit because it, made us realize that we need a way to get, educational materials out to them and let the hospitals know that, public health is here to help them. In public health, we are not part of the health department that oversees those hospitals. So it's an interesting partnership. So there are still some people waiting out and doing surveillance for wild birds in Los Angeles, and I think, even up in Alaska. But, I think most people don't realize that it's a poultry smuggling issue, and that, but there are still a lot of people. We get calls every day saying, a crow died and it has avian influenza, and we have to explain to them, well, it's probably, West Nile virus, and the mosquito abatement districts will test for that. But no, you don't have bird flu. It hasn't advanced to that level yet.